Dr. Jaffe, how does it, a teenager or less than 20-year-old show lymphocyte response assay sensitivities to chemicals that have been either banned in the US for more than 30 years and not even used in most of the world now? So how do they come up positive to certain things that have not been used in so many years?
Right. How do people come up reactive on the LRA test to substances that should, according to environmental World Health experts, should have been eliminated from the environment 20 or 30 years ago? The classic example is 2,4,5-T. 2,4,5-T is also known as dioxin. This was used in abundance during the Vietnam War. We learned a lot about its toxicity subsequently. Officially, 2,4,5-T has been unavailable for use in anything that humans would get exposed to, except it is a given that when you made 2,4-D, 2,4-D is the most commonly used weed killer today in the world. When you make 2,4-D, a small but detectable amount of 2,4,5-T is also made. You don't want to do it, but you can't do the chemistry without making a small amount of the side product. And now, it's a little technical point, but if you look at the blood in the placenta or the blood in the cord that connects mom to baby when the baby is born, you can get a sample of the blood from the umbilical cord. The average American woman today has 43 xenotoxic chemicals, 43 artificial chemicals that man has introduced that are not in nature. The average person has 43, of which 2,4,5-T is detectable in over 3/4 of the women. How is this possible if it has been off the market and unavailable for longer than the child has been born? Well, it turns out it's a lipophilic, fat-loving molecule. And it can stay in the fat of the individual for decades. It's hard to get rid of. It is easy for the body to retain it. And if you change your weight, like you grow, and you convert some fat into growth tissue, into bone and joint and lean muscle, as you should as a young person, your fat pad might have had 2,4,5-T or similar off-the-market molecules from before you were born. And if you were breastfed, if you were formula fed, you got different adverse effects. But mothers today sometimes ask the question of how much weed killer 2,4-D, how much 2,4,5-T do I have in my breast milk that I'm giving to my child? Now, as you know, the baby's saliva tells the mother's areolar breast tissue what the baby needs. And if the baby needs more fat, the baby gets the fat that has the chemicals that are fat-loving in it. So even though these have been off the market as too toxic for use, sometimes for decades, it is possible for a young person, someone less than 20, to have an immune reaction to 2,4,5-T. And now, since we don't know where the exposure came from, but we know this is a long-lived lipophilic fat-loving molecule, now we might want to use low-temperature saunas to get sweat oils that contain these fat-loving, long-lived molecules out of the body. Notice I said low-temperature saunas. 105 to 110 degrees Fahrenheit. That is relatively warm, but not hot, because you want to mobilize sweat oils That happens slowly. Very often people stay in the low temperature sauna for 45 minutes to an hour. You stay in until you have an oily sheen on the surface of the skin, and then you go into a shower with a loofah and a castile soap so that you wash off that oil before it reabsorbs back into the skin. And when people do this, I've had colleagues and individuals tell me that sometimes when they do the low temperature sauna, they get the smell of a solvent like benzene, zoluene, toluene, orthotoluene. And other times, the oil is not clear. It contains a compound that has a color. Well, you want to have some color in your body and you want to have some color in your diet, but you don't want to have color in your sweat. So the issue of being immune reactive to molecules that have been banned for years is surprisingly understandable, because these are still recirculating in our food supply, in our environment, and in our bodies. And when the fat is being used for energy, when you're changing the amount of fat in the body, either because of growth, as young people should do, or just because you want to have more lean muscle and less fat pad, when you change your body fat, you may get exposed to these molecules, which are rather potent as sensitizing molecules. So you can have them in your sweat without being immune reactive, and I would recommend getting them out with low temperature saunas. And importantly, you can have these as sensitizing molecules when the lipophilic, when the capacity of the body's fat pad gets saturated. Because there's only so much solvent and what we call persisting organic pollutant. Some people call these hormone disruptors. There's a reason why you want to minimize your POPs, your persistent organic pollutants, your solvents, your toxic metals, your mold byproducts, your radioisotopes. There's a reason why you want to minimize exposure to all of them, because they are anti-nutrients. They are oxidizing substances in their own right, and they reduce your body's natural defense, resilience, repair capacities. And then they can be sensitizing because they alter the body's own molecules, and they can be sensitizing at remarkably low levels. And that's why we include them in the LRA by ELISA Act tests, even though they've officially been off the market for decades.